Hi everybody, Dr. Kistler here. I have had a few questions from patients regarding the exercises that I have you do both here in the office before you get adjusted, as well as whenever you're at home doing your home care exercises. Now, a couple of those questions are, one, what do these exercises do? Why am I doing these exercises? That's a great question. I want you to understand why you're doing everything it is that I recommended for you to do. I find that obviously my patients get the best results when they understand what they're doing, but also why they're doing it. I also get asked, is it important that I do it here in the office? What if I did it at home or I did it at work a half an hour, 2 hours before coming into your office? Is it important that I do it again whenever I'm here? And lastly, I get asked, how long would you recommend that I do these exercises? I like to do them. How long can I do these exercises? So we're going to take those questions in order. So these exercises do a number of things for the health of your spine. Now, one of the reasons I have you do them here in the office, and the exercises that I'm talking about are the traction up here on the wall, as well as the wobble discs. And the reason that I have you do these here in the office is because they help to loosen up the ligaments and the muscles surrounding the spine. Whenever those ligaments and muscles are relaxed, whenever they're loose, that allows us to shift gently the spine into a better position. Whereas if the muscles are tight and the ligaments are tight, it's a little bit more difficult to be able to adjust and shift the spine. So to be able to allow the adjustment to go as smooth as possible, I have you do a little bit of warm-ups before doing it. Now, is it important that you do it here in the office as opposed to doing it elsewhere before coming in? Yes, it's very important. And this is the analogy that I love to give. What if a sprinter, an elite Olympic sprinter, did his warm-ups 2 hours before his event? Would that do well for him and his muscles during the event? Or should he do his warm-ups immediately prior to the event? The reason you do the warm-ups immediately before you do the adjustment is because that way we can make sure that the muscles, the ligaments are loose and that they don't re-tighten after you do the exercises. So it's very important that you do those exercises when you're here in the office. Now, in addition to just loosening up the muscles and the ligaments surrounding the spine, these exercises have a lot of other benefits to them. The study showed that the only way for your discs, which are the little pads that separate your vertebra, the only way for those to stay healthy and to stay hydrated is through motion. Whenever you put motion into the spine and into those discs, they pull fluid into them. Pulling fluid or rehydrating or imbibing them is what we call it. Whenever you pull that fluid into them, that allows them to get plumped up slightly. So a lot of patients will ask me, if I have arthritis or degeneration, is there anything that can be done for that? Or can we just maintain and prevent it from getting worse? And the answer is yes, there is something that can be done for that. These particular exercises can help pull fluid back into the discs to a degree, reverse the arthritic process, reverse degenerative disc disease, right? So it's incredibly important, and that brings me on to the last question, which people like to ask, how long would you recommend that I do these exercises? And I'm going to tell you that you can do these exercises for life. These are what I consider spinal hygiene. Hygiene being something obviously that you do to take care of something. Dental hygiene to take care of the health of your teeth. This spinal hygiene is done to take care of the health of the wellness of the spine. Right now, of course, we want to take care of the wellness of the spine for the spine's sake itself, to prevent degeneration, arthritis, which is the #1 cause of disability in our country. If that wasn't enough, the bigger reason why we want to take care of the health of the spine is because of how the spine is intimately related with your nervous system. Study after study shows that poor spinal health leads to poor neurologic health, leads to poor health in general. If we want to keep you healthy, if we want to keep you living the quality of life that God designed you for, we need to take care of the spine. So you can do these exercises every single day for the rest of your life, and you won't be anything but healthier for it. Lastly, I wanted to say that if you're here in the office and it is an amazingly busy shift, which I love to see, lots of people coming in here and getting their power turned on, getting healthier themselves and or their families with them, and you're here and you're waiting to get adjusted and it's not your turn, you're going to be waiting for a couple of minutes, I would like for you to continue to do the wobbles while you're waiting. Now, you don't have to do it quite as vigorously as when you're normally doing the exercise, but I have you continue to do those wobbles to again continue to maintain the laxity of the muscles and ligaments before you get adjusted. If you have any other questions regarding these exercises or any other exercise that I've given you to be able to take care of the health of your spine and your nervous system, don't hesitate to ask.